There are so many rumors and myths which are floating around regarding the coronavirus, which has been the hot topic, and also the world has declared the health emergency. So many of the individuals have their own opinion about the coronavirus. In spite, the World Health Organization as well as the Center for Disease Control has been giving a proper educational resource to the general public. So here I am quoting the same resources, and I want to give the inputs to all the public about the coronavirus. Here we have the questionnaire regarding each and every point regarding the coronavirus infection. Coronaviruses are the large family of viruses which are found in both animals and humans. Some infect people and are known to cause illness, which is ranging from the common cold to more severe disease such as middle-aged respiratory syndrome and severe acute respiratory syndrome. So a novel coronavirus is a new strain of coronavirus that has not been previously identified in the humans. The novel means new, right? So had not previously detected before the outbreak which was reported in Wuhan, that is in China, in the late 2019, that is at the end of December 2019. So the novel coronavirus is from the same family of the viruses as severe acute respiratory syndrome, but it is not the same virus and it is completely different. So when we talk about how dangerous it is, so as with other respiratory illnesses, infection with the novel coronavirus can cause mild symptoms including a runny nose, sore throat, cough and fever. And fever is considered to be the most common manifestation, as it is seen in almost greater than 90% of the cases. And it can be more severe for some of the individuals. For examples like in children as well as in the older people, that can lead to pneumonia or breathing difficulties. And more rarely, the disease can be fatal, as I already mentioned, that the older people as well as the people with a pre-existing medical conditions such as diabetes and heart disease, these patients are more vulnerable and it is fatal for these individuals, and the individuals become severely ill with the virus. So here the detailed investigations found that the novel coronavirus was transmitted from cats to humans in China, that is in 2002, as well as from camels to the humans in Saudi Arabia in 2012. But the several known coronaviruses are circulating in animals that have not yet infected humans. As surveillance improves around the world, more coronaviruses are likely to be identified. So here the animal source of the novel coronavirus has not yet been identified. So this does not mean that you can catch the novel coronavirus from any animal or from your pet. It is likely that an animal source from a live animal market in China was actually responsible for some of the first reported human infections. So to protect yourself from this deadly coronavirus, when visiting the live animal markets, avoid direct unprotected contact with the live animals. And the consumption of the raw or uncooked animal products should be completely avoided at this point. Raw meat, milk or animal organs should be handled with care. And to avoid cross-contamination with uncooked foods, as per good food safety practices, need to be maintained right now. There are so many myths as well as the posts which are coming across the social media and the Facebook as well as in the WhatsApp regarding the contamination of the coronavirus with the animals, more commonly from the pets. The answer for this question is no. That is, at present, there is no evidence that the companion animals or pets such as dogs and cats have been infected or have spread the novel coronavirus. So it is very important for us to know about the spread of the infection from person to the person. And we have been getting the results as well as from the data that this infection has been spreading from person to the person. So stay aware of the latest information on the outbreak which is available on the WHO website, and take care of your health by doing some of the important steps. That is, wash your hands frequently with an alcohol-based hand rub or soap and water. Why it is important? So washing your hands with an alcohol-based hand rub or soap as well as water kills the virus if it is on your hands. So it maximum prevents the spread of virus to you. And another important thing is the maintenance of the social distance, that is maintaining social distancing. So maintaining at least 1 meter, that is 3 feet distance between yourself to the other people is extremely important at this point, particularly those who are coughing, sneezing and have a fever, because these are the symptomatology which can say that they may be infected with this deadly virus. And why it is important? Because when someone who is infected with a respiratory disease like novel coronavirus coughs or sneezes, they project small droplets containing the viruses, and these small droplets which are thrown into the air has lot of virus. And if the person is very close, 1 feet or 2 feet distance, it is very easy for this individual to take that virus through the inhalation and another person can get infected. That is the reason if you are too close, you can breathe in the virus and there is a much more danger that the virus can enter in your body. And another important step what you have to take here is avoid touching eyes, nose as well as mouth, because hands touch many surfaces which can be contaminated with the virus. So if you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. That's the reason you have to take proper care over here. If you have a fever, cough and difficulty breathing, it is important for now at this point that you need to seek a medical care as early as possible. And also tell your healthcare provider if you have traveled in the area in the China where the novel coronavirus has been reported, or if you have been in close contact with someone who has traveled from the China and has the respiratory symptoms, because it is very important that you have to explain your symptomatology to your healthcare provider when you have such kind of symptoms. And why it is important? Because whenever you have a fever, cough as well as difficulty in breathing, it is important to seek a very immediate medical attention promptly, as this may be due to the respiratory infection or maybe any other serious condition. And important point to be noted here that the respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, the novel coronavirus could be one of them. So why to take a chance? So you have to go to your healthcare provider immediately when you see such kind of symptoms. And if you have a milder respiratory symptoms and has no travel history to or within China, carefully practice basic respiratory and hand hygiene and stay home until you are recovered if possible. So this is the way you can prevent maximum of the contaminating with deadly coronavirus. Now coming towards the wearing of the mask. So wearing a medical mask can help limit the spread of some of the respiratory disease. However, using a mask alone is not at all guaranteed to stop infections and should be combined with other preventive measures, including the hand and respiratory hygiene and avoiding the close contact, at least that is 1 meter, that I have already mentioned, that you have to maintain the 3 feet distance between yourself and the other people. So if you see the data from the World Health Organization, WHO advises on the rational use of medical masks. Thus, avoiding unnecessary wastage of precious resources and potential misuse of masks. So this means using masks only if you have respiratory symptoms is important, that is coughing and sneezing, that have been suspected in the latest novel coronavirus infection with the milder symptoms, or caring for someone with the suspected coronavirus infection is important here. So a suspected novel coronavirus infection is linked to travel in an area in the China where the novel coronavirus has been reported, or close contact with someone traveling from China and has the respiratory symptoms. So these steps has to be taken at a serious note. So before putting on the mask, wash hands with alcohol-based hand rub or soap and water, and cover your mouth and nose with mask, and make sure that there are no gaps between your face and the mask. And avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water, and replace the mask with the new one as soon as it is damp, and do not reuse the single-use mask at any cost. And to remove the mask, remove it from behind. Do not touch the mask from the front, and discard the mask immediately in a closed bin. After that, wash hands with an alcohol-based hand rub or soap and water.